Hello, I'm Amoret from Cape Cod Community Media Center. For those of you living on the Cape, you know that it's a lovely place to live, but sometimes it can seem difficult to find a livable wage job that you can be proud of. Cape Cod is not only a tourist attraction, we have a wealth of livable wage jobs for young, educated people, including those in the healthcare industry. I'm here at Community Health Center of Cape Cod in Centerville. Here, Cape Codders have access to a variety of different health services from numerous people from numerous backgrounds. Community Health Center of Cape Cod's goal is to give their patients the best possible care and experience with them. With us today is Chris Ellis, the Senior Development Associate at the Health Center. He has been with this institution for over 2 years, and his job is to oversee fundraising and communications components of the organization.
Hi, well, thank you for interviewing me. So I work at Community Health Center of Cape Cod, and we have 5 offices here on the Cape, primarily on the upper to mid Cape, and we have a wide range of employment opportunities. So we have 180 staff members. There's about 65 different job roles within the organization. So really there's kind of a wide range of opportunities, whether you have a medical background or not. There really is something for pretty much everybody.
What would you say the salary range is for these positions? Like, is it a livable wage? Like, is it over that?
Yeah, it's definitely a livable wage. Across the board, our minimum wage for all positions is $15 an hour at the bare minimum. So it is nice that, people are coming in and it is something that they're working hard, but they're getting paid well for the work that they're doing so that they can, afford to live on the Cape if they do, or if not, if they're living right off Cape, that they can still kind of afford to be able to work in this industry.
Is it a high level of demand for those positions?
Yeah, there is a high level of demand for the positions. Like I said, there's 180 give or take employees that we have, and usually at any given point, we usually have about there's maybe 7 to 12 positions open at any given time. What's good about kind of our industry is that healthcare is always needed by people. So it's the kind of thing that, no matter what the month, what time of year, especially with it being such a seasonal nature on Cape, while it gets quieter in the winter times, there are still people that live here and still people that need their health care.
My name is Fernanda Noguera, and
What is your position here?
I do patient registration here. So I do the front desk, and I basically help run this office.
How did you apply for this job? How did you go about it?
I started doing patient registration in Mashpee, and from there I worked through different departments.
Would you say that there's a lot of growth here?
For me, there was. I've had about 4 different positions here, so for me it's been great.
That's awesome. So have you lived on the Cape your whole life?
Yeah, I moved here from Brazil when I was 8 years old, and I've been here ever since.
So have you just been looking for jobs on the Cape because you love it here?
Yeah, I wouldn't want to leave.
Yeah.
So, yeah, I've had opportunity to go to Boston. I could have moved, but I really love the Cape and staying here. And the Brazilian community here is pretty big, so.
What else do you love about the Cape besides your job?
Everything's pretty close. You get to see a lot of, diversity. Everything's pretty simple. You know what I mean? Like, you live, a nice, easygoing life. Like, you're not, running around. You get stuck in traffic in the summer, but other than that, it's pretty good. People are always like, there's nothing to do on the Cape, but if you live here and you meet the right people, there are so many things for you to do. I actually prefer winter here, so.
Really?
Yeah. I like my position here. Yeah. Mm-hmm.
Awesome.
We just opened up this office back in December, so
That's awesome.
I don't think I'm going anywhere for a while.